Thanks for joining us today for a featured video on COVID-19 with Dr. Frank Petruzella, Chief of our Pediatric Emergency Department. He's here with us today to answer some questions about how the Pediatric Emergency Room is operating during the COVID-19 outbreak. My name's Mara. I'm from the Chore Marketing Team. I'm behind the camera, safely practicing some social distancing. I think we're more than 6 feet apart now.
I think we're safe.
Yeah. If you have any questions, please leave them in the comments below and we'll do our best to get back to you within a week. So Dr. Petruzella, as a dad and ER doc, what advice do you have for families during this time?
So I think the first piece of advice is just stay healthy, right? So make sure that we're following all the recommendations from pediatricians, from the health department, from the health authorities, about social distancing, about not gathering in groups. Wash your hands. Hand sanitizer is hard to come by, but nothing beats soap and water. And then the other thing is try to take advantage of this. It's the first time in a long time that a lot of us have actually had time with our children. So take advantage. We've been doing things at home like been cooking together and breaking out the old board games. The other thing is get outside. It's a beautiful time to get outside and be healthy. Not just don't be sick, but be healthy. Spring in Virginia is my favorite place in the world, and there's nothing like social distancing out in the great outdoors.
And what would warrant a trip to the ER during these ever-changing times? I know a lot's going on and hospitals may be saying different things, but as a parent, what do you think would warrant a trip to the ER amidst COVID-19?
Yeah. So actually, that's kind of an easy question because it's really not much different from what would warrant a trip to the ED without COVID-19. So, for almost 15 years now of doing this, the advice that I've been giving to parents is if your child is having mild symptoms, some fever, maybe runny nose, a little bit of sore throat, but they're still eating well, they're still acting well, they're still breathing fine, they're not having any difficulty breathing, they don't necessarily need to come see me. You can treat them at home the way that that we were treated growing up. Some Tylenol, some ibuprofen, some fluids, make them some chicken soup, a lot of good rest. Mm-hmm. And what really the difference with respiratory illnesses is how long they last and how severe the symptoms are. So if the symptoms are lasting longer than 3 or 4 days, particularly the fever, if I have fever that's lasting more than 3 or 4 days, that's when I want to make sure that I'm getting my child checked out. Or similarly, if the symptoms are more severe, so they're having trouble breathing, in infants that can be manifest as poor feeding, so they can't catch the breast, so they have trouble feeding. Or if they are not making wet diapers, indicating that maybe they're dehydrated, or if they're really struggling to breathe. Obviously, we would want to see them in the ER for that. And then all the other things, right? Cuts and broken bones and asthma attacks and those sorts of things, we're always there for.
Awesome. That's great to know. So stick to routine.
Correct.
Is Chore's emergency department providing testing for COVID-19 at this time? I think that's a question that you guys are probably getting a lot and would like the general public to know.
Yeah, absolutely. So, as everyone knows, testing is very limited right now in the U.S., across the U.S., not just in Virginia, not just in Richmond. And so Chore has a very limited amount of testing capability. So currently, we're unfortunately not able to provide COVID-19 testing just for anyone. And actually, all of the tests that we do have to be cleared through our epidemiology and infection control department. So they are really being allocated to severely ill patients who need hospitalization.
Got it.
Yeah.
So if there is an incident at home or someone's a little bit sicker than usual, what should parents and guardians do before visiting the ER? Do we need to call first? Is there a certain number? What's the procedure for that?
So again, sort of standard operating procedure here, right? So if your child is sick and you're wondering, are they sick enough to come to the ER? Your first call needs to be to your pediatrician. Or if you have a child with special needs who's followed by subspecialists, you may want to call the subspecialty service first. We always have someone on call that can field those calls for you. You know, unfortunately now, just like any other time, our nurses and physicians are not allowed to give medical advice out over the phone from the ED for a lot of different reasons. But the biggest reason is we can't see your patient. We can't see your child. So if I can't see your child, it's hard for me to make those decisions. So you really need to rely on the practitioners that know your child, have their records in front of them, that sort of thing. Now, as far as other resources, there is a hotline, a COVID hotline on the CHOR website. That is for our current patients. If you're already a patient here, you can call that hotline, and there are staff members there that can help guide you through whether you need to come and be seen for COVID specific or COVID related issues.
Yeah, and the hotline number is 804-628-7425. That's listed on our website. If you go to chrichmond.org, it's right there. Again, that is just for current patients who feel that they have or parents that feel that their child has symptoms of COVID-19. So the Children's Pavilion has a bunch of new visitor guidelines in place. Those are going out on social media pretty regularly, and they haven't changed in the past week or so. But are there new ER visitation guidelines that you would like parents to know about?
So similarly, not brand new. They've been in place for about a week or so, and they're hospital wide. They're tough. They're kind of hard for parents to deal with, because we are actually limiting visitors to one visitor per patient, which as a dad I understand is very difficult when you walk in with a sick child and you have to choose, am I going to stay with them or is mom going to stay with them? But the reason we're doing that is really for safety, and it's for safety of our patients, and it's for safety of our staff. We screen all of our visitors with temperature checks and symptom checks, but there's always the possibility that someone makes it through that screening, either undetected or because they're not yet having symptoms. And so we really need to limit the number of people that come in and out of the hospital in order to really flatten the curve and make sure that we're not spreading this unknowingly.
Yeah, as hard as it is, it's great to know that CHOR's taking those steps to really focus on the safety of everyone in the building.
Absolutely.
And around. So when those visitors are trying to decide who gets to go, when do you think families should stay home and avoid visiting?
So from a visitation standpoint, I think that I understand not everybody has childcare, right?
Mm-hmm.
Not everybody has the luxury of saying, I'm going to take this child and not this child with me. That being said, if you do have the option of leaving siblings at home or leaving siblings with other relatives or friends, really the safest thing is just to come with you and your child who needs to be seen. If not, then we'll have to cross that bridge when we come to it. We understand that not everybody is in the same situation.
Great. So how can parents provide supportive care for their kids, and how can families manage any symptoms of COVID-19 at home?
Sure. So luckily, and this has been borne out by several different studies from across the world, children do really, really well with COVID-19, right? So even if they get the coronavirus, the symptoms of the illness the vast majority of them are mild. Some of them, up to 40% of them, are totally asymptomatic. They have no symptoms at all. And as far as serious illness, hospitalization, and mortality, it's essentially zero worldwide. So we talk a lot about supportive care, right? So what does that mean? That just means, or symptomatic care, it just means taking care of the symptoms. So the symptoms are going to be the same symptoms as any cold. You may or may not have fever. Again, up to 40% of kids will not have fever with this. So there may not be any fever to treat. They'll have some runny nose, they'll have some sore throat, and they'll have some cough. Over-the-counter cough medications are really not recommended in children under the age of 4. So for symptomatic care, what we're talking about is managed discomfort, and discomfort can be managed with Tylenol or ibuprofen, both of which are very safe, and rest, and then things like a humidifier in the room to help with nighttime cough, nasal saline to help with any nasal congestion. As always, if you have questions about this, you can contact your pediatricians.
Great. It's always a good reminder to remember how resilient kids are during these times.
That's why I take care of them.
Yeah. So if a child has chronic illnesses and they often visit the ER or any hospitals, how should a parent handle that, and who should they call first?
Yeah, so one of the big things with children with chronic illnesses, one of the big things to keep in mind is oftentimes their subspecialist or their pediatrician really knows that child best, aside from the parents, of course. They really know that child best, and so calling them first should be your first line. They're going to know the history, they're going to know how they tend to respond to different treatments and how they react to different infections. One of the other things I like to remind parents as an ER physician is an acute illness, when somebody is sick but they have a chronic condition, that's not the best time to seek a second opinion or try to change subspecialists. Again, because me as an ER physician, when I'm taking care of that patient, I may not have all the information that the subspecialist at a different institution might have.
And this is another hot topic that we see all over social media, all over the internet, TV, news articles, etc., and that's face masks. Do I, if I'm a parent or my child, should we be wearing masks into the ER when we visit?
That's a great question. So it's a fairly simple answer, and what we've done to help sort that out is we have a screener that now sits out basically at the entrance to the ED. That screener is going to ask you a few simple questions to figure out whether you or your child is having respiratory symptoms. You coming into the ED, for you to wear a mask, what that is doing is that's protecting the staff and the other patients around you until you get into a room where we can close the door. So if you're not having any respiratory symptoms, you don't need a mask. And what we've actually done in our ED is we've set up 2 separate entrances, one for patients with respiratory symptoms and one without, to help try to stop any sort of inadvertent spread of any illness, really. We actually haven't seen any COVID-19 in our ED, but just in general, we don't want to spread illness amongst our patients. So if you do need a mask, our screener will give you one and give one to your child, and then we will walk you directly back to a room. If we get to the point where our ED is full and you're going to have to spend some time in our waiting room, we've also set up 2 separate waiting areas. Similar to a lot of the community pediatricians, we have a well or non-infectious waiting area, and then one for folks with respiratory illness.
That's awesome. It sounds like our ED has taken a lot of steps to really prepare themselves for this.
Yeah, we have, and we've had the benefit of several weeks of knowing that this was heading our way, to be able to sort of think proactively and set things up like those separate waiting areas, which didn't exist 10 days ago. We've also been able to set up a couple of extra rooms, which didn't used to have doors. They used to just have curtains, and we've now put doors on all 4 of those so that we can isolate more patients as we need to as this respiratory illness comes our way.
Great. Those are great precautions, and it's awesome to hear that we're very prepared for what could come in the future.
Absolutely.
So what are we considering to be the worried well, and why is it so important for them to stay at home if they are truly well?
Sure. So worried well is a term that we use in a lot of different situations in medicine. And basically what it means is folks who really either don't have symptoms or have extremely mild symptoms and probably don't need medical evaluation, but they've been hearing so much about some sort of epidemic, whether that's influenza, we saw it with swine flu, or whether with this outbreak with COVID-19, and these folks are just so nervous that something bad is going to happen to them that they come in for medical evaluation, even though they don't probably need it. It's human nature. I mean, we're inundated by this day in and day out. The reason why it's important for those folks to stay at home, really twofold. Number one, if they don't have an illness, coming to the ER or coming to the doctor is a really good place to get exposed to people who are sick. So if you are actually well, coming out into a place with sick people is a good place to get sick. And number two, in a situation with a pandemic, the one thing that we want to avoid in all of our healthcare environments is overwhelming the system. And if I have to expend a bunch of resources taking care of folks who may not actually need medical attention, it may divert those resources away from more sick individuals.
Yeah, we completely agree. It's best to stay at home during this time, especially those that are well.
Absolutely.
Is there anything else that you wanted to add or inform anyone about?
No, I think social media is great for a lot of different reasons. This being one of them, it's a great way to get information out. I just like to caution everyone about social media or about the internet in general. There are a lot of things that you can read that may not be accurate or may have been accurate until we had better information and are no longer accurate. Instead of relying on your coworker's friend for medical advice or medical information, just stick to the resources that are really vetted. Our website, our CHOR website /COVID-19, we're updating that constantly with new accurate information. There are plenty of websites out there that you can, the CDC is another great one that you can go to for accurate information.
Great. And yeah, if you go to our homepage during this time, right above it'll provide a link to the COVID-19 page specifically, and that is where you can find the most up-to-date information as well as some great blog posts with activities for your kids to do while they're home, different references, and other frequently asked questions. Again, if you have any questions, feel free to leave them in the comments below and we'll try to get to them within the week.